My presentation is trying to look at overall strategic relevance of MMS, giving you what is the background situation, the problem of nutrition in Rwanda. As you can see, the country is dealing with kind of triple burden of nutrition, though there are a lot of progress made over the last decades, but there is still high level of stunting, there is still high level of anemia, and there is also rising concern on obesity and overweight. So this is the problem. But we also did further study on drivers of stunting, and we realized that of all explainable determinants or factors of stunting in Rwanda, 31% is contributed due to maternal-related factors, maternal anemia, maternal BMI, maternal height, and all major or dominant determinant factors for stunting are found to be maternal. So these are the issues that made MMS more strategic than an introduction of a product or switch from IFAS to MMS. And also if you look at other areas, yeah, nationally there is high level of anemia, but also if you look at IFAS coverage or uptake, though there was dramatic improvement from 2015 to 2020, but the national average is only 15%, still within fully covered or financed IFAS availability through the public system. Similarly, we have an issue with high-low birth weight and also preterm. ANC first registration had always been 100% or above, but the first trimester standard contact is around 50%, and then when you go to the fourth contact, it is very low. So there are a lot of comprehensive issues spanning around maternal and child health and nutrition. So this led to now the solution, the program design. In the program design, there are 3 pillars we are focusing on. The first pillar is all about policy, the enabling environment and guidelines. And the second pillar is all about system strengthening and quality nutrition service delivery. So this is where the comprehensive maternal health and nutrition lies, including MMS provision. And of course, the third pillar is looking at public financing for nutrition to ensure, including MMS inclusion into the health insurance and the performance-based payment system, sorry. So MMS fall under system strengthening and quality nutrition service, but to improve or positive health and nutrition outcome for both mothers and children, addressing the comprehensive health and nutrition issues. So how did we introduce it? In 2022, the earlier background problems and solutions were discussed at interministerial level, led by the Office of the President and the Office of the Prime Minister. And there are 6 key accelerated solutions or interventions design. One of the 6 key pillars or accelerated interventions design include maternal nutrition, strengthening ANC, and the introduction of MMS. So that's when we developed in 2023 the national guideline, and then we have been struggling in early days to get the supply, but finally once we get the supply, we started or launched the program in 7 districts out of 30 districts of the country in early 2024, and this is the first MMS tablet being delivered by His Excellency the Minister of Health in Rwanda. So the achievement for us, it's not all about implementation, research, blah, blah, because as I told you, when we define one of the 6 programs to accelerate health and nutrition outcome of the country, we had already agreed on existing global knowledge or evidence, because this thing is there for the last 20 years. Developed countries have been benefiting, and mothers in urban countries who can afford prenatal tab have been using these things. So for us, it's not about research, but rather about how best we can gradually and systematically integrate MMS as part of a standard care package within the maternal nutrition and health systems. So, but still to address few issues like coverage, adherence, we found out a very impressive coverage. So we reached during the last couple of months about 55,000, and the national average coverage is 98%. 98%. And the same way, when we look at adherence, anecdotal information show us adherence is 4 times compared to IFAS, close to 60%. So what we are doing now is just to triangulate, verify, because all this data, we don't have vertical system, we don't have separate reporting system. It's existing HMIS that would be pooling and reporting this information. So we are now having additional layer of research to validate and to look at rigor of the data in terms of our findings. There are a lot of questions, coverage, adherence, mainly on SBCC. We are doing currently the SBC barrier analysis led by University of Rwanda. These are some of few questions. Yeah, thank you very much. And of course, there are also few challenges. Maybe one of the challenges is something that we can collectively address at the global level in terms of, one, streamlining or better coordinating available resources, whether it is funding or not, because the more multiple or duplications are happening, I'm afraid that fragmentation could be an issue. And at the same time, the recommendation, why do we keep that recommendation? Because if it has been already there, and mothers who are able to buy, including my wife, who have benefited in all her 3 pregnancies because we can afford and we can buy it, why do we keep that recommendation now when it comes to an opportunity or equity of African mothers or low middle income mothers? Why do we need the rigorous research? So this is something that we may really need to tackle and address. Otherwise, locally, we have an issue of people moving around. The trained healthcare providers, sometimes they move, so we need to continuously train in those 7 districts all over the hospitals and health centers. The finance and supplies to scale up. We are advocating on the public financing. Most likely, the government will start matching, but at the same time, we also need to look at after the maternal acceleration period, after the 2-year period. Current grants who are flying all over are maximum of 2 years grant. So what do we do after the 2 years? Are these countries are able already to sustain fully transiting into public financing? So the donor side also needs to look at a bit flexible and longer term financing to ensure countries are fully ready integrating it into their health system. Thank you. Have a good day.